And so Dr. Zoe is current president of NAS, is a professor at Leahy Hospital and Medical Center. Welcome. Thank you.
Thanks so much, and thanks to the Scientific Program Committee for the opportunity to talk about CSRS Registry. And I want to just focus on first the rationale for it, the funding for it, and then ultimately the type of data that will be generated as a result. In terms of disclosures, I have some disclosures that are not relevant, both commercial and extramural funding. But I want to acknowledge Julie Witham, who is our national data coordinator for the CSRS Registry, who is enormously helpful in making certain that this works. One of the first questions that we contemplated at the CSRS was, if we have ASR, which is a robust registry that includes both lumbar and cervical cases, and that's working, why do we need CSRS registry? And I think one of the things that we thought about is that ultimately, when we think about the diagnosis and ultimately the treatment impact of what we do in spinal surgery, we rely on advanced imaging. We rely on postoperative imaging in many situations. And the ability to collect that data we thought would be very, very important. And so one of the things that is important to us at CSRS Registry is the capture of radiographic data for storage, for research, as well as for safety evaluations. And I'll talk about that in just a moment. Just a little bit of background. We focus on patients with cervical myelopathy, worldwide leading cause of spinal cord dysfunction, as well as cervical radiculopathy. And it's estimated that we do about 160,000 operations for these problems in the United States each year. And so our goal here is, how do we create a research data platform that captures the baseline and follow-up imaging, as well as the instrumentation used in these cases, so that we can study that. We started with a generous grant from Medtronic, in which we were very grateful for, $250,000 in 2017, to build the foundation for CSRS Registry, which was based on a previous research platform. And today, we have a platform that is relatively low cost, about $55,000 a year to maintain the registry, and that is jointly sponsored now by DePuy Synthes and Medtronic to maintain the costs so that the society is not paying for the registry. We have a number of sites engaged, and we're very much in our early stages. We have 8 sites that are actively enrolling, and we have another 6 sites which are in the process of being engaged that you see here. But again, in our early stages, we have 828 patients with full data sets collected from 8 sites. And we, again, are doing that at a relatively low cost from a registry standpoint, which I think is important. Just in terms of the breakdown of cases, we have 62% of our patients with radiculopathy, about 1 out of 4 with myelopathy, and a smaller percentage with a combination of the two. We also are looking at the procedures and the prevalence of the procedures. AC-DNF is our dominant procedure that we follow, with also a collection of posterior fusion cases, laminectomy, laminoplasty, and cervical arthroplasty included. When we look at some screenshots of our data collection, you can see here that we capture the history from the medical record for each of these cases, and we collect also the baseline imaging, including the axial imaging at the cervical spine levels of pathology. We also collect the instrumentation implant data, as well as the validated patient-reported outcomes, the PROMIS 10, for example. In addition to all of that, we have our postoperative imaging, which is in the form of flexion and extension radiographs at 1 and 2 years after surgery, which is important to us. And it's important to us for this reason, and probably this reason alone. When we look at the ongoing funding of the CSRS Registry, we recognize that the need that both the FDA and the European Union have for long-term data surveillance is critical. And that long-term data surveillance is maintained is contained within our postoperative imaging. And so that's what we aim to collect, in addition to the patient-reported outcomes. There's also a need for the the Cervical Spine Research Society Registry to communicate with the American Spine Registry, and Praveen Mumanini is leading that effort at UCSF as a pilot site to take a look at how do we transport data back and forth between ASR and Cervical Spine Research Society so that we reduce the burden of sites in terms of the data collection for two separate registries. But ultimately, our goal is to be able to have a very clean crosstalk between the registries. We published the results. The first data set from the CSRS registry will be coming out in the Clinical Spine Journal, and we also provide the data sets to individual sites on a quarterly basis. So again, this is a work in progress, and we're in our early phases, but a pleasure to talk about Cervical Spine Research Society Registry with all of you. Thanks.